people don't think of that as a cause for cough, but these are probably the top three.
And what about COPD?
That comes next in line, COPD, or chronic obstructive pulmonary disease. That is a serious progressive illness, and we see that most commonly in smokers, but it can be seen in non-smokers as well. And something that's really kind of frightening about this is there are 24 million cases in the U.S., 1 in 12 people, but half of them don't know they have it, and so we as physicians need to be better about recognizing that.
They don't know they have COPD.
No, they just have a cough and may not know when to get it checked out.
So there are a lot of times when a cough is more than a cold symptom.
There is things like pneumonia. So if you have a cough, but you have other symptoms that go along with it, chills, fever, nausea, weakness, even chest pain, that can be a sign that you have something more serious going on.
So how do you treat a cough if it is pneumonia?
Well, big thing here, viral versus bacterial. We talk about this often. You don't want to overuse an antibiotic in a viral situation because it's not going to help. But if you do have a bacterial pneumonia, we can give you antibiotics, and in turn, that's going to resolve the cough. But it can sometimes take a few weeks before it's gone.
Now, can air pollution cause this?
It absolutely can. Some people are more sensitive, and even short-term exposure to exhaust fumes, especially diesel, can really kick up a cough and cause a lot of fun for people. Mold, that's common, not just in the air, but if you have mold growing around your home, that can be, if somebody just comes in with just kind of that chronic all the time, that could be an exposure.
Now, are there other causes that are maybe less common?
There are. Acute bronchitis, and people think, well, that's really common, but you may not see it as often as you think. So if you've had a cold, and most of your symptoms are gone, but then suddenly you start coughing and bringing up a lot of mucus, that could be an indication that your airways are inflamed. There are a couple medications that can do this. ACE inhibitors, which is a very common class of medicines used for blood pressure and heart failure, and I actually see this quite a bit in my practice. And then pertussis, or whooping cough, and that's where you hear that real characteristic whoop. And we have had some clusters of outbreaks here in the St. Louis area and all over the country recently, so it's something we have to keep in mind.
So at what point should a person go see the doctor because of a cough?
If you've been coughing 8 weeks, you need to get in and get checked out. If you have some of these other symptoms we've talked about, chest pain, fevers, then you should go in sooner. But anybody who's coughed for 8 weeks needs to get